Hello everybody, my name is Martha Kennedy and I'm one of the CCSs with Nexion Healthcare. Today we wanted to do a little education with our licensed nurses, just talking about things that we may not think of, but we want to remind you how important it is. Now we know that some of our residents are short-term with Nexion, and that means that they go home or they may go to assisted living, things like that. What is important when the patient is going towards discharge is also as important as they're coming in. What I mean by that is the assessment, how they're changing. If you notice that they've gotten better, but maybe they're having a little bit of a decline or any kind of pain. A lot of our residents come in, maybe they have had a fractured hip or something of that sort where they're not really moving around a lot. And so we know that there's complications that can come from that. Some can be that maybe they've developed a new skin area. Maybe they're constipated. Maybe their blood pressure has gone up because they're used to laying down in the bed and they're getting up more. These are so important that we do that thorough assessment. If you have a patient that is nearing discharge, I can tell you that the patient's going to say, oh, it's nothing. But if a patient's having nausea, you're having to medicate them for nausea, a headache, maybe they're constipated. These are so important that we do an assessment. A bowel assessment would mean that we're listening to all four quadrants, right? We're listening to see if there is any slowing of those bowel sounds. If they're throwing up, that could tell us, hey, there's something going on down there. If they're constipated, you know how when the hospital calls us and we always say, when's the last time they had a bowel movement? Same thing for when they're going home. It is so important that when they leave us, that they have successful outcomes and that they're ready to go home. That would mean that they're taking their medicine with them, that they're also have things set up at home health care, a doctor's appointment. We tend to do all of those things, right? But we have to remember as prudent nurses, if that patient is leaving us, that they're leaving us in good health. Little things like constipation can turn into huge things that can cause somebody to get really sick. So if you have a person that's asking for a PRN, let's talk to the doctor about what's going on. Do we need to watch them? Do we need to order more tests? Do we need to do something to make sure that this patient will be able to go home and stay home successfully? It is your job as the prudent nurse to make sure that that assessment is completed, the doctor's informed, the responsible parties informed, and that they're going home to be successful. That's our job. That's our job as skilled nurses. Thank you.